So today, given all the confusion and misinformation we've had about immunizations and who gets them, who's able to get them, and whether your insurance covers it, we have with us today Dr. Simi Casasola, who is a pharmacist with Walgreens. She's a doctor of pharmacy. She's a graduate of Mercer University, and one of her foci is advocating for better community health and equity. She's recognized for her leadership in the pharmacy, and I won't talk about operational things because I want you to know clinically how important having a pharmacist on your medical team is. So she's a pharmacist with greater than 25 years of experience, and she is going to help us understand how we can maximize our pharmacy to get what we need out of it. And in this era, and in this time, at this time of the year, the importance of getting immunizations and how you can secure them from your local pharmacy. So Dr. Casasola, the stage is yours.
Thank you so much, Dr. Parker, for the invite and also for having me here. I would love to share some of the information what a Walgreens or any pharmacy can offer to you. So quickly around Walgreens. Walgreens has been around over 125 years. It is a cornerstone of the local communities and continue to helping people to live healthier life through personal care and trusted advice, like Dr. Parker mentioned, providing all that consultation and services for our patients and customers in the community to make sure that they have all the information they need in order to take care of their health. And we are very accessible, right? As a pharmacist, you can walk into any pharmacy, not necessarily needs appointment, and accessible to everyone in the community. I am so happy to be here to sharing some of the services, especially most of the pharmacies are providing these services and really cater to what Walgreens can do in your communities. And our impact goes beyond our pharmacy counters. We have strategic partnership and environmental stewardship, really protecting our environment. We do take some steps to make sure that we are doing our part and also a huge community investment. You will see we are in your community all the time providing, like Dr. Parker mentioned, vaccination or other services to ensure that community and the customers and the patients and everyone has the information they need. So our goal is to really helping people to live more healthier and more connected and better lives. So, like I mentioned, our purpose is to create more joyful lives through better health. Health is so important, and we want to make sure that we are educated, we are aware, and how to get all the information we need. And our vision is to be really the leading partner in reimagining local healthcare and well-being for all. We have our leadership behaviors, we call them 4 C's, really to ensure that all of our team members are living in our vision and serving our purpose to the communities we are serving. So 78, why we are focusing on the community, 78% of Americans lives within 5 miles of a Walgreens. Through our 4 pillars, healthy communities, inclusive workplace, and sustainable marketplace and healthy planet, we are continued to making our communities better. As you can see on the screen, we are invested around flu shot vouchers, almost 10.9 million investment to ensure that, which exceeded our 5 million goal, to ensure that our uninsured patients and customers and the communities, they have access to the flu vaccines, to educate them about the importance of those vaccines. And our disability index, equality indexes continue to be 100 over 100, and we are continue to making sure that people with the disabilities have a place within our Walgreens. and they are able to provide the services we are offering to all of our communities. And we also have a different partnership with the clinical trials. And the goal is that to create diversity among clinical trials. So we were almost 44% diverse clinical trial participants we were able to include through our clinical trial programs. Then again, we have offered tons of financial assistance for the prescriptions services for our patients, almost 2.9 billion over 4 years. It all kind of bringing it together to ensure that we are working to be the best community retail pharmacy in the United States and make sure that we are accessible to everyone. So now we look at the services we are providing, and I think that's what everyone is very eager to know and understand. How can you access the pharmacies? How can you get all these services? As you can see, from neighborhood pharmacy to all the way to ensuring the convenience is there, and making sure you get all your everyday essential, the vitamins and to your prescription medication, and even the complex medications you are taking. We make sure that it is easy to get to you on your hand so you can protect your health. So, of course, the retail excellence. We are a pharmacy, we are a community pharmacy, but also we have all those retail products. Being the retail aspect of the Walgreens or the pharmacies that anyone can walk in anytime during our operating hours and speak to a pharmacist. There's always a pharmacist available for you. Then pharmacy services, we do fill prescription, but beyond that, the pharmacists are a clinical clinician who can provide the consultations, and that goes whether providing that immunization services, answering questions about your medications, and follow up with you when you are late to take your medication. So if there is any issues preventing you to be adherent to your medication, and also provide some health screening where it's allowed. Every state has a different rules and regulations what services pharmacists can provide. We do COVID test and other tests in our pharmacies in Georgia, and clinical services like medication therapy management, something Dr. Parker mentioned earlier, we provided in our all locations. We also offer virtual healthcare. A lot of people are not aware about the virtual healthcare, and it is only available for the states. It is allowed, and Georgia is definitely one of the states. We do offer virtual healthcare. You can receive that service on Walgreens app, and it's a 24/7 chat with the pharmacy expert, and to ensure that how to manage your prescriptions and if there is any questions, or if you want to see a doctor or a nurse practitioner to some of the certain health conditions, you'll be able to get that service if you are unable to reach your physicians or your primary care physicians at that moment. We also have specialty pharmacy services, which provide very personalized care for chronic, rare, complex health conditions. And I will go in a little bit more detail what is that services we are offering and where is the specialty pharmacies are located in later on. Then I already mentioned some of the healthcare services, which really making sure that the communities and our patients and customers receiving all the solutions for their payers and their health system, making sure like Medicare Advantage plans, having accessible to those plans. Now it's the registration time for, especially for those people who are 65 and older. You can get that information from your pharmacy. And just for the convenience factor, we do offer pickup and delivery of your medications and other retail products as well. These are some of the services we provide for the community and the patients and the customers. I do see a questions. What are the clinical trials you provide access to? What about financial support for uninsured? So we do have a clinical trial program. How it works is that we provide the access to that participants. So patients, when they choose a clinical trial program, we as a pharmacist and at a community pharmacy, we get notification that patients who's meeting certain criteria, they will have the option to opt into that clinical trial specific. Then we provide that information. Patients or customers who walks into our pharmacy, we ask those questions and they will opt into that service. Then from our clinical trial team, they will reach out to that participant or who shows interest to be participate into the clinical trial. They do further research. Community pharmacist, we don't have a lot of information around it, but we are ensuring that the diversity is there and diverse participants are included in the clinical trials. Financial support for uninsured, a lot of that comes through. We have something called RX Savings Finder, allowing our patients and customers, when they are uninsured or underinsured, their medications are costly. If you go to any community pharmacy, especially at Walgreens, there is a QR code available, or you can ask your any team member, technicians, or the pharmacist in the pharmacy about the RX Savings Finder, which provide you, when you scan the QR code into your mobile device, it will scan you and tell you most of the medication covered and what will be the cost of majority of that, which discount cards they can use. Then if you're talking about specialty pharmacy, they are working with the tons of different foundations to ensure that if they are uninsured or underinsured, their copays are $2,000, $1,500, and they won't be able to afford it. They work with a lot of foundations and different copay assistance programs. They will be collect all the paperwork, whatever is needed, help the patients to complete that application and provide that service for those patients, which helps us to make sure that they get that assistance and also helping the patients to receive their medication. Probably at no cost, at a very affordable price. Then another question is, can you just briefly speak on what shots may be taken at the same time? COVID, flu, shingles. How long should we wait for before taking other important vaccine? Absolutely. That will be a really good segue to our next slide. Pharmacy services. As you can see some of the pictures here, every picture represent the services we are offering. Of course, you can walk into the pharmacy and ask for consultation, whether it's an OTC product or having a situations or a health conditions you're experiencing. We pharmacists always will have to refer you to a physician or give you the right guidance to take the next steps whenever you have a questions. And if it's about a medication, pharmacists went through that pharmacy school, received all those clinical knowledge and understanding, whether it's about a side effect, how long a medication should take, what are the adverse reaction you are experiencing, taking in combination with the other medications or food or anything like that you are experiencing. They will be able to guide you through that. The pharmacists have received the training. And always remember, it's not a bother to the pharmacist. Always come to the pharmacy, talk to the pharmacist, and they are there to provide that service or the information for you so you can make the best decision for your health. Then we will move on to immunization. We have seen that most of the patients and customers now receive their immunization services from the pharmacy. So we offer all immunizations. There are certain immunization we cannot do. One of them will be yellow fever vaccine. You will not receive that from a pharmacy in Georgia, especially from a Walgreens. You probably will have to go to a health clinic or your doctor's office or travel clinic to receive that vaccine. Other than that, most of the vaccines are will be able to receive or accessible to any pharmacies. There are certain vaccines we will have to order for you to receive it, but always come and ask for any vaccines you need. If you are using our app or using Walgreens.com, you will be able to make an appointment for your vaccine. If some reason we don't have it, we always will be able to place an order. And by the time you come for your appointment, we will have the vaccine and we will be able to provide all the information. So, can you take all the vaccine at the same time? We do receive these questions all the time. And yes, there is no upper limit. If you look at the CDC guidelines, there is no upper limit of how many vaccines you can receive. You can receive as many vaccines at one appointment or one time you can. So we encourage that most of the time. It saves time for the patient. There is only one observation period after receiving the vaccine. We always ask you to stay in the pharmacy for around 15 minutes after receiving vaccines. Whether you receive one vaccine or 5 vaccines, observation period is around 15 minutes. Then you will be protected. It will generally take around 2 weeks to build the immunity for any vaccine you are receiving. So we always tell our patients and customers that do not wait for day before you start your travel or day before you're visiting your grandbaby to receive your Tdap or receiving your COVID vaccines. You want to make sure that you are planning ahead to receive the vaccine. And this is the respiratory season, and we are at peak. Like it was mentioned earlier, in Georgia especially, the cold weather has started. I needed a jacket today to go out. It's rainy, it's cold, holidays are coming, so don't wait for the last minute. Go to your pharmacy. No appointment needed. Any pharmacy, your pharmacy or Walgreens, you will be able to receive all the vaccines you should be due to receive. So just a general guideline. So any patients who are 65 and older in a respiratory season, we recommend for them to receive the flu, COVID, and if they haven't received their pneumonia, Shingrix, and RSV vaccines, because we want to make sure that respiratory season is extremely important to ensure they are protected. This is the time easy to get sick. Holidays are coming, so to decrease the hospitalization and complication, you want to make sure that you are receiving all those vaccines. And if you're 50 and older, we recommend the same vaccines, especially if for RSV vaccines, you need to have health conditions. Health conditions means if you are at a high risk to have an infection, if you're diabetes, if you're a smoker, if you have any frailty, if you have your doctor think you're at a high risk to be exposed to those viruses and get that infection, we recommend for you to receive, according to the CDC ACIP guidelines, to receive that RSV vaccine if you're 50 and older, along with the Shingrix, pneumonia, flu, and COVID as well.
Excuse me, Dr. Casasola. This is Dr.
Yes.
Parker. For the audience, this means that if you're a diabetic, if you have asthma, if you have COPD, or you're suffering from cancer or being treated for cancer, or you're taking an immunosuppressant drug like for rheumatoid arthritis, ulcerative colitis, or any of the itises, and you're getting an injection for that, you need to receive a vaccine. So that's what they mean, special conditions.
Thank you, Dr. Parker. Absolutely. And if you have any questions or concerns, of course, talk to your physicians, but talk to your pharmacist. We are there to answer any concerns or questions you have. when we talk about the health condition, and it's a wide variety of health conditions, immobility, frailty, like all those cholesterol, diabetes, if you're a smoker, all those are included. So we want to make sure that you are aware of all the vaccines you need to receive in order to protect you. Then there are also some questions around vaccines on the chat. Are the vaccines for children as well as adults? Yes. In the pharmacy, if you are 3 and older, pharmacists will be able to administer flu and COVID vaccines for anyone 3 and older. If you are under 18, for children, we do require a prescription for other vaccines, like if they want to get their HPV vaccines, or if they have other if they are diabetic and the patients want to receive certain vaccines, they want to be able to protect it. We want to make sure that they do receive those prescriptions if they are under 18. But flu and COVID vaccines, we do not need prescription. Any children 3 years and older will be able to receive those vaccines in the pharmacy. Another question is, spoke about Walgreens prescription programs. What specific programs can you highlight to lower the med cost? So we have something called RX Savings Finder, which like Good RX, but it's not just Good RX. We have RX Savings Finder. It's a QR code. You can see it at pharmacy. It's posted in almost all Walgreens pharmacy, where you can scan the QR code and put your medication name, which will bring up all the discount cards available or covering at a lower cost for that specific medication. So it may not be the Good RX will be the cheapest, and there may be another discount card will be cheaper. So you can choose that discount card and hand it to the pharmacy team, and they will be able to process the cost. Based on the manufacturer and NDC, costs can be slightly different. So we always tell the patients that just be patient as we process it. But you scan that QR code and you will be able to receive all the discount cards available to cover that medication. And you can get that QR code from any Walgreens pharmacy. And it's posted. There is a poster in the pharmacy. There is a lot of buck slips available, and it's all situated on the counter, so you can easily access them. What is the best way for Alzheimer's caregivers to make the most of a medication consult with the pharmacist, especially when managing complex Alzheimer's treatment? Absolutely. I would just walk in and ask the pharmacist to bring the medications to the pharmacy, or when you pick up those medication, we offer consultation for every medication as the patient pick up. Not a lot of time patients or caregivers ask for the consultation, but I would highly recommend when you are in the pharmacy, stop by the pharmacist and the consultation window and ask them, I have some questions about the medication. Can I get some consult? Or you picking up a new medication or a refill medication, just tell that team member who is ringing up, whether it's a drive-through or at that out window, when you get the medication, that you would like to speak with the pharmacist. Most of the time, there is a question asked. There is a question on the pin pad, or the team member asks, do you have any questions for the pharmacist? I would highly recommend you utilize that time to say, yes, I want to speak with my pharmacist. And they will direct you to that consultation window. Pharmacist will come to the window and be able to provide the information you are requesting. Are thyroid disorders are considered special conditions? Yes, I will highly look at the CDC website. There is a lot of health conditions highlighted. I will take a look at it to confirm that any thyroid disorders are considered one of the health conditions. In a lot of cases, yes, it is one of the health conditions to make sure that you receive all the vaccines you needed. What are the ways pharmacists can help simplify medication schedule for someone with the memory challenges? So, There are, we recommend, there are many ways we recommend for our patients when they are told us that it is one of forgetfulness is one of their challenge staying adherent to their medication. We recommend them to have the pill boxes, just the regular method. It's just the fact that they're just forgetting to take medication. I would tell you, even I don't have that memory challenges, I still forget to take my medication every night. So have some kind of reminders letting us know. Couple of things we recommend: have a pill boxes right next to your nightstand if it's a mild challenges. Have an alarm. If you have a smartphone, have an alarm on the smartphone. We do have some pill box reminders if there is any patients or customers can have blindness or they cannot remember. We have a talking pill reminders available in the pharmacy you can purchase. It talk to us and remind us that, hey, this is the time for you to take that medication. It's called Talking Pill Reminder, and it is available in all the Walgreens pharmacy. We highly recommend our patients to really let us know exactly what is some of their challenges are, and we find some of those solutions for them to ensure that they remember to take their medication on time and daily. Another question is, for Alzheimer caregivers that provide support from a distance, how can pharmacists help coordinate care and ensure those caregivers have appropriate access to med info while maintaining patient privacy? That is the key. Patient pharmacy privacy is extremely important, and as you all are aware, HIPAA, we have a very stringent policies and procedures to ensure that we protect HIPAA for all our patients and patients. There are some things you can do. We want to make sure that we do have your HIPAA permission is in our pharmacy system. You can provide your caregiver authorization to pharmacy. We will keep it in our files. We also put it in the system. That will allow us to be able to speak to you as well, and it allow you to coordinate those care for those patients. A lot of time we will get the calls or the messages where a caregiver is calling us to get the information for their patients or loved one to ensure that they get their medication. Did they pick up their medication, or can we get more information around it? Unfortunately, if we don't have that permission on file, our pharmacist will not be able to provide any of that information to you. So you want to make sure that the caregiver information is on file and we have all the documents needed if you are the caregiver for your loved one. I did answer most of the questions on the chat, but just looking at, like I said, it's a wide variety of services the pharmacy will be able to provide for our patients and customers, rather than just filling that prescriptions, to ensure that we all stay healthy. And moving on to some of the medication therapy management, this is something Dr. Parker mentioned earlier. It depends on your insurance company, your payer. So medication therapy management services, optimizing the outcome, the therapeutic outcome, the utilizing those medication for our individual patients. And there are two parts to it. One is a comprehensive medication review, and the other one is called targeted medication review. Walgreens really received that reimbursement through our partner vendor Outcomes. Outcome is a vendor where the payers, like when I talk about payers, is that Humana, United Healthcare, Express Scripts, they are contracted with the vendors like Outcomes. They will say, we want these patients need to get care from the pharmacist through comprehensive medication review, we call them CMRs, or targeted medication review, kind of help our pharmacists to reach out to this patient and provide those services. So, what is comprehensive medication review? It is a interactive medication review conducted by our pharmacist to assess the patient medication, really optimizing their therapy and to ensure that they receive that outcomes. So this is a paid service by the payer. We go through all the medications patient have taken and make sure that they are taking it. Is there any challenges they are experiencing? And go through in detail and ensure that the services are provided. And at the end of the service, a action plan created for the patient is mailed to the patient if the patient is not in front of us. It can be provided face to face and also through telephone for the patients. Then targeted medication review, it's very targeted, specific reason. For example, we have a diabetes patient who's not on a statin. Their payer is like, this patient will be affected through statin, means those cholesterol medications like atorvastatin, Lipitor, or rosuvastatin like Crestor. Those medications are needed for a diabetes patient to protect the organs. So payer is like, we need this patient to be on certain medication. Can you reach out? We will reach out to the patient. Patient said yes. Then we will contact the prescriber to ensure that, hey, is this a miss? Is this a reason why the patient is not receiving this therapy? We already spoke with the patient, and would you mind sending us a prescription for the patient so we can protect the patient? Or if it's a refill, payers like insurance companies, sometimes they have all your medication history. They may see that you haven't filled your blood pressure medication for last 60 days or last 30 days. So it's kind of letting our pharmacy that this XYZ patient have not filled their medication. Can you reach out to the patient to find out what is going on? Is there any challenges? Then the pharmacist will call that patient. So this targeted medication review is very targeted. It also specializes if they need an immunization, or they pick up a new Alzheimer's medication or their dementia medication, and it's a brand new medication. They need that consultation. So it letting us know that this is a new medication. Let's call the patient and provide that consult. For Walgreens, most of the patients who receive, whether it's a blood pressure, diabetes, or cholesterol medication, and some other medication like for dementia or other health conditions, our pharmacist, if it's a brand new medication, our pharmacist will call that patient within 3 to 7 days to ensure that they started the medication, there are no side effects, if there is any other support they needed. That is a service Walgreens offer beyond what is the service provided by the payer, asking us to reach out to those patients. So you do get those calls. One of the challenge I would say that our patients and caregivers really answering those calls and making sure that it's from Walgreens. It's really to maintain their health and answering those calls and when we call them. So those services are available for you. There is any delivery service available for do not have access to a local Walgreens? If so, how far out are the delivery services and is there a fee? Delivery services are available. DoorDash services, some of those Uber, DoorDash couriers we use, it's around within 15 miles of a Walgreens, but we also use FedEx in sometimes to deliver. There is a cost for delivery. With the FedEx, you can deliver to ground service and almost anywhere in the state. And we try, unless we don't have a retail pharmacies don't have specific license to out of the state to deliver, but within the state we'll be able to deliver through FedEx delivery. You can also, if you have Walgreens app, you can also request delivery. You fill a medication with the Walgreens and you can, once you see that it's filled, you can request delivery through your app, and we will be able to deliver that medication to you. The cost is around $3.99 for that ground service deliver the medication. Certain patients and certain conditions, they waive the delivery fees. It's because if the patient did not get a chance to pick up the medication, it has been past certain days, and Walgreens have as of right now, that can change anytime. We have an option to waive that fee if there are some unforeseen circumstances and they won't be able to pick up the medication within next 3 days. So it's very patient to patient, service to service. If that charge, if it's free or if there is a charge for those medications. I think I was contacted by Walgreens to participate in a research study. How do I confirm that this was legitimate invitation and not fraudulent? Is there a number called to confirm? $3.99 for the delivery fee, Dr. Parker. I apologize. Then is there a number to call and confirm? Most of the study, you initially gave permission at your local Walgreens, then they are reaching out to participate in the study. I do not have the number, but right after this call, I can research the number and provide it on the chat to make sure that you have that information. So you will be able to confirm that it's a legitimate call. Going a little bit more detail on comprehensive medication review, the service we were providing. Like I said, we will review so we always ask the patients to be a little bit more, it's a bit time consuming, anywhere from 15 to 20 minutes. So we ask them to be patient, and because we have to ask all their health conditions, we have to ask all their allergies, we have to document all that medication. Then we have to go through medication one by one to make sure they are still taking it. Is there any side effect? Is the patient taking it as it was prescribed? Is there any challenges they are experiencing? So we want to document all that information. Then finally address any concerns. Whether it's a barrier, like earlier mentioned, that patients who have forgetfulness, or if it's a disease state related, like they have hypertension or high blood pressure, they feel like their medication is not helping. Always their blood pressure is high, even though they are taking medication. So we ask very detailed questions to the patient to make sure that we address their concern. Then we take all that information, and if there is anything we need to communicate to the prescriber, we will do that on behalf of the patient. Then, of course, a patient takeaway, like I mentioned, all the details, all the communication will be provided to the patient so they can easily review that and make the right actions to ensure their health is always taken care of. Then these are some of the additional focus on that adherence. This service is very much focused on that adherence and the medications patient need. Like I mentioned, it can be face-to-face or through telephone to ensure that the service is available to everyone who is eligible to receive it through their payer. Then you can always ask your insurance company if you can receive this service. A comprehensive medication review can be requested by the payer and can receive from Walgreens. Even if you don't have an insurance or you don't have the payer paid, if you have questions about your medication, you can stop by at Walgreens or any pharmacies or your pharmacy where you're getting the medication at any time. To consult with a pharmacist, because we are there to provide these services for you. Then I talked a little bit about virtual healthcare. It's a 24/7 chat. You can chat with a pharmacy expert. But if you need an online doctor's visit, some of the health conditions, women's health or skin and hair, allergy, asthma, you're on a Saturday, suddenly you are run out of your inhaler, you are asthma patient and you need it. I have used it for my kid who needed an inhaler, or a quick allergic reaction. Not urgent cares are not open and it's on the weekend. We should be able to call our virtual health care, and they do not accept insurance. This is a fees from 33 to 79 years old, and this is for 18 plus for children. It takes quite a few. Pretty quick, within 30 minutes, you get connected to a physician to be able to receive the care. But you do need to download that Walgreens app, and you can see that if you are a state, let's say one of the state or South Carolina, North Carolina, they don't have the service, you won't see that option on Walgreens app. I may missed how much it does a comprehensive medication review cost. So we don't charge the patient for comprehensive medication review. This is asked us to provide it by the payer, that is by the patient's insurance, and they cover the cost if it's completed in a timely manner. But even for a consultation, at this time we don't charge the patients for their medication. It is a service as a pharmacist we should be always there to provide for you. Then going back to specialty pharmacy, we want to make sure that this is a very chronic, rare, complex health conditions like cancer, hepatitis C, which medications are HIV, neurology, or organ transplant. This medication cost a lot of money, and this is where in Atlanta we have 3 to 4 specialty pharmacies. And if anyone need Dr. Parker or anyone else need to connect with a specialty pharmacy, please let me know. I will be able to connect, and they will be able to provide connect with the prescribers and to assist to ensure to get that medication. We also have an office around Gene and Cell Services Pharmacy and Innovation Center in Pittsburgh. They really working through the new therapies and to ensure that these services are available for patients and communities in anticipation of that, where our treatment options are going, right? Then we also have central specialty pharmacy. Any medications cannot covered by our local specialty pharmacy, like we have 3 or 4 in Atlanta. It will be sent to that central specialty pharmacy to be able to help. So if you have any of those complex disease state, let me know, and I will be definitely able to connect to a specialty pharmacy to make sure that if they can support with the financially or prior authorization and all that stuff, working closely with that physician. That's all I have. If you have any other questions, please don't hesitate to reach out to me.
That was thank wonderful. You so much. Yeah, that was great, Dr. Casasola. So I just wanted to reiterate some of the things that I heard. Number one, you can get virtual care after hours if you're a Walgreens patient with a Walgreens app. So get your relatives to show you how to load that. You hear me, Emily and Crystal? Yes. The other thing that's really, really important is that these medication consultations that you need are free of charge to you because they're paid for by your insurance. My suggestion, because I live in a very busy community, is not to ask for these medication consultations at 5 o'clock in the afternoon, anywhere between 4 and 7, when most people who are working are off. Those of us who are retired can come in at 9 or 10 and probably be able to spend a little bit more time. So those are only my caveats. Thank you. Thank you all for joining us today. Thank you, Dr. Casasola.
Thank you for having me.
And Dr. Casasola, we had so many questions pouring in that we were just overwhelmed at the response from people. There's a lot of curiosity and a lot of questions. Do you advise that they visit the Walgreens website if they have more questions about this specific program?
Absolutely. If you go to walgreens.com, you will see most of those. You can download the app or stop by your neighborhood Walgreens and talk to the pharmacist if you have any specific questions. Absolutely.
Thank you so much to Dr. Simi Casasola and Walgreens for joining us today. Thank you for helping keep our community be healthy and safe through vaccinations. We love that.